So Eli Lilly reported a massive 36% revenue growth. That kind of jump is almost unheard of. What's driving these incredible numbers?
Well, it's largely thanks to the demand for their new weight loss medications, Mounjaro and Zepbound. These aren't your typical diet drugs either. They're tackling a key issue that a lot of people struggling with weight loss face: managing hunger and cravings.
And that's huge because, let's be real, sticking to a weight loss plan is tough. So if these medications can help people feel fuller for longer and resist those tempting snacks, it's no surprise they're flying off the shelves.
Exactly. What's more, these medications are making a real difference in how we manage obesity and diabetes on a global scale. We're talking about better blood sugar control, improved cardiovascular health, and a real chance for people to improve their quality of life.
But with great success comes great challenges, right? There's been a lot of talk about Eli Lilly struggling to manufacture these medications fast enough to meet the demand.
Yeah, it appears their own success created a bottleneck. But it's worth noting that they're investing heavily to address this. A cool $5.3 billion into a brand new manufacturing plant in Indiana.
$5.3 billion. You've hit the big leagues when you're throwing around numbers like that.
That's not just a big number for Eli Lilly. It's actually the single largest investment in this type of drug production in U.S. history. It really highlights their commitment to making these treatments more widely available.
It's clear they're playing the long game here, which is encouraging. But hold on to your hats because there's more. It wasn't all about weight loss this quarter. Eli Lilly also received FDA approval for a new Alzheimer's drug, Cassunla. Not to mention, they've got positive trial results for a heart failure treatment using a drug called Tzepatide.
And that brings us to a particularly interesting point. Tzepatide, which is the key ingredient in Mounjaro, belongs to a class of drugs called GLP-1s. And they are creating quite a buzz right now.
Okay, time for a quick breakdown. For those of us who aren't scientists, what exactly are GLP-1 drugs, and why are they such a big deal?
Good question. GLP-1s were originally developed for type 2 diabetes. They work by mimicking a hormone in your body that helps regulate blood sugar. But here's where things get interesting.
I'm intrigued. Tell me more.
Researchers began to notice that GLP-1s also led to weight loss. And we're not talking about small, insignificant amounts. We're talking about clinically significant weight loss that can make a real difference in people's lives.
So essentially, they stumbled upon a medication that could potentially treat two major health concerns: diabetes and obesity. No wonder everyone in the pharmaceutical world is paying attention.
Precisely. And this is where Eli Lilly's early investment in Tzepatide, which they began researching back in 2016, really gives them a leg up. They have a significant head start in understanding this drug and its potential applications.
It's like they had a crystal ball and saw the future of weight loss treatment. But as we've been discussing, actually producing these drugs at the scale needed is no easy feat. It's kind of like baking a cake that suddenly everyone in the world wants a slice of. You need more than just a good recipe. You need the capacity to make it on a massive scale.
Exactly. It's a complex process with lots of moving parts, from securing raw materials to navigating strict quality control standards.
And speaking of navigating a complex process, Eli Lilly had some strong words about a potential shakeup in the manufacturing world. It involves a company called Catalent, which is being eyed for acquisition by none other than Novo Nordisk, one of Eli Lilly's biggest competitors in this space.
Yeah, this proposed acquisition has caused quite a stir. You see, Catalent is a contract manufacturer, which means they produce drugs for other companies, including Eli Lilly.
So if Novo Nordisk takes over Catalent, they'd essentially be in control of producing medications for their competitor. Talk about awkward.
That's exactly Eli Lilly's concern. They're worried about potential conflicts of interest if their competitor also becomes their manufacturer.
It does seem like a tricky situation. On the one hand, contract manufacturers like Catalent play a vital role in the pharmaceutical supply chain. But on the other hand, having your competitor control a key part of your production process is less than ideal.
Absolutely. Eli Lilly even voiced concerns about potential industry bottlenecks if all contract manufacturers become captive to big pharma. In other words, they fear it could stifle innovation, particularly for smaller biotech companies who rely on these contract manufacturers.
It's like the old saying, too many eggs in one basket. But speaking of challenges, Eli Lilly isn't just focused on manufacturing hurdles, they're also tackling another issue head-on: compounding.
Ah, yes. The DIY approach to GLP-1s. Now, before we dive in, it's important to understand that compounding itself isn't inherently bad. It has its place in medicine, particularly for customizing medications for specific patient needs that can't be met by commercially available drugs.
Like a custom-tailored suit. But for medicine.
Precisely. But in the case of GLP-1s, we're seeing people try to make their own versions of these complex medications at home or in unregulated settings. And that's where the alarm bells start ringing.
Okay, so instead of adjusting the thread on that custom-tailored suit, they're trying to weave the entire thing from scratch.
A somewhat risky endeavor when you're talking about something as important as medication. You see, Eli Lilly has been very vocal about the potential dangers of this practice.
And for good reason, right? We're talking about people's health here.
Exactly. Eli Lilly has even gone so far as to analyze samples from compounding labs, and the results are concerning to say the least. Some contained potentially dangerous impurities, while others weren't even Tzepatide at all.
You've got to be kidding me. That's incredibly dangerous.
It is. And to make matters worse, these compounded versions often lack proper sterilization, which opens the door to infections and other serious complications.
Wow. So it's not just about the effectiveness of the medication. It's about basic safety. What is Eli Lilly doing to address this issue?
They're taking a multi-pronged approach. They're working with regulators, exploring legal options to crack down on unsafe practices. And most importantly, they're raising awareness among patients about the potential dangers of compounded GLP-1s. They want people to understand that while these weight loss drugs are promising to act, obtaining them from legitimate sources and under the guidance of a healthcare professional is crucial.
It's like the old saying, if it sounds too good to be true, it probably is. But here's something else to consider. Eli Lilly's vision for the future extends far beyond just tackling obesity and diabetes with GLP-1s. They're thinking much bigger picture.
Absolutely. They're actively exploring new frontiers in metabolic health, going beyond simply treating symptoms to understanding the underlying causes of these chronic conditions.
So it's less about putting a Band-Aid on the problem and more about figuring out what's causing it in the first place.
Exactly. For instance, they're diving into research on a serious liver disease called NETH-HA, or non-alcoholic steatohepatitis, which is becoming increasingly common. They're also exploring how different medications could be combined for a more holistic treatment approach.
So rather than just treating the symptoms of obesity or diabetes, they're looking at the bigger picture of metabolic health and how everything is connected.
Precisely. And just like everyone is excited about the potential of GLP-1s, there's another area creating a buzz that Eli Lilly is involved in: oral GLP-1 drugs.
Hold on. Are you telling me we might be able to ditch the needle someday? Tell me more. Imagine that. Popping a pill instead of giving yourself an injection. That could be a game changer for so many people who are hesitant about needles.
Absolutely. While oral GLP-1s are still in development, it shows you the direction things are headed. And it's not just about convenience either. Eli Lilly is also looking beyond weight loss as the primary goal.
Okay, now this is where it gets really interesting for me. What else are they exploring?
They're researching treatments that focus on specific aspects of metabolic health. Think body composition, preserving muscle mass, and addressing those underlying metabolic issues that contribute to a whole range of chronic diseases.
So it's about more than just fitting into a smaller size. It's about actually improving your health at a fundamental level. It's like they're saying, hey, let's not just slap a Band-Aid on the problem. Let's figure out what's causing it in the first place.
Exactly. And remember we talked about Tzepatide, the key ingredient in Mounjaro. Well, research suggests it might have even more potential beyond obesity and diabetes.
Wait, it gets even better.
It seems so. There's growing excitement around Tzepatide as a potential treatment for sleep apnea and even heart failure.
Wow. It's amazing to think that one drug could have such a wide-ranging impact on so many different health conditions.
It really speaks to the potential of GLP-1 drugs to address a whole range of what we call cardiometabolic conditions. These are conditions that affect both the heart and the body's metabolic processes, things like high blood pressure, high cholesterol, and insulin resistance.
It's like they're piecing together a giant puzzle with each new discovery, revealing a little bit more about how our bodies work. So after diving deep in all of this, the big question is, are we on the verge of a metabolic health revolution?
That's the million-dollar question, isn't it? And while it's still early, the signs are certainly pointing in that direction. For years, we've been tackling these chronic diseases, obesity, diabetes, heart disease, as separate isolated issues.
Right. Like they each belong in their own little box.
Exactly. But with these GLP-1 drugs and the research Eli Lilly and others are doing, we're starting to see the connections. We're beginning to understand that metabolic health is a complex web of interconnected processes. And if we can find ways to address those underlying issues, it could drastically change how we prevent and manage these conditions in the future.
It's a bit like realizing that the leak in your roof is actually caused by a crack in the foundation. You can keep patching the roof, but until you fix the foundation, the problem will keep coming back.
That's a great analogy, and that's why this research is so exciting. It has the potential to change our entire approach to healthcare, from treating symptoms to addressing the root causes of these diseases.
It's like shifting from a fix-it-when-it's-broken mentality to a more preventative, holistic approach. We're not just talking about adding years to our lives, but adding life to our years.
Exactly. And that's a future worth striving for.
I couldn't agree more. It'll be fascinating to see how Eli Lilly and other pharmaceutical companies continue to push the boundaries of what's possible in the realm of metabolic health. Now, here's something for you to ponder. Do you think these advancements are just a temporary fix? Or could they fundamentally change how we approach health for generations to come? Food for thought.